G'day, my name's Esther. You're joining us here on Transmission with Bent TV. And here with me today is Jeremy Wiggins. Tell us why you're here.
Thanks for having me. So I'm the Trans Health Project Lead at VAC. And so VAC is the Victorian AIDS Council, and we've been working with LGBTI communities for a number of years. And about a year and a half ago, we opened Equinox, the Gender Diverse Health Centre, which is a super exciting initiative where we run. It's co-located with Pronto in Fitzroy, so it's 175 Rose Street, Fitzroy, and we have general practice, sexual health services. We have a trans counsellor, alcohol and drug services, and we employ transgender diverse people to work there. So it's a community-led, peer-led health centre.
That is fantastic.
People. Yeah.
And I say that from a place of experience because they're the cutest receptionists getting around.
They are. I mean, it's a really cool renovated warehouse space, so it's like fun and modern, and the team there are amazing. And you know, Dr. Pauline Cundall and Dr. Neil Silverstein and Peter Locke and the others all there do a wonderful work, and we've already got close to 400 patients.
Wow.
There. There's clearly a demand, of course, because you know our history of experiencing healthcare has not always been the best. People have a lot of negative experiences, or can go to any sort of mainstream GP and they might not be knowledgeable enough or sensitive. So what we're trying to address here at Equinox is creating a safe and trans-affirmative practice, so people can actually enjoy the experience of going and seeing their doctor, which they do. We think it's really successful if someone can turn up in their pyjamas to go to the doctor.
Is that what's going on?
Yeah.
Okay, because I'm putting on my cutest outfits every time, but maybe I should be
hey, the
playing
polarised thing's good. Everyone's got a spot.
Cool. So tell us, I mean, Equinox is really exciting on its own, but there's some new stuff happening there. Can you tell us a bit about it?
Yeah, so recently we launched our informed consent model. So informed consent is a model of care where patients have an autonomous right around the decision making with regard to access to hormones. So traditionally in Australia, people need to go see a clinical psychologist or psychiatrist for a number of sessions to get a diagnosis of gender dysphoria to be able to access hormones. And that's a fairly pathologizing model. It's a fairly medicalized model. It increases barriers to access to hormones in terms of cost, waiting list. A lot of the services that are publicly funded have long times to wait, and we know that when trans people sort of want to medically transition, it's quite an urgent thing. So we don't have long waiting lists, and we've created this model, and it's based on the Callan Lord Community Health Centre in New York, and they provided permission to us. I met with them a couple of years ago, and we have got good relationships internationally. And it's the first publicly released model. So yes, we are using it, but any GP around the country can now download this model and go, I can also see clients and follow this pathway.
Wow.
And what that means is that people just need to go to see the GP to be able to get access to hormones.
So you don't have to live in the vicinity of Fitzroy then to benefit from the work of Equinox?
No, that's right. It's the benefit of the work goes across the nation. It may even reach across the seas. You know, once something is published and it's credible document that's gone through rigorous community and clinical consultation like this document, and it's been endorsed by ANZPATH and also Monash Health, the gender clinic, it can be used by any GP that's wanting to support, and people shouldn't have to leave their like rural or regional town to go travel into the city to see a GP. They should be able to have local access.
Absolutely.
Yeah.
So you mentioned that it has been community consulted, so that's part of what Equinox does, right? Can you tell us a bit about that? Yeah,
so when we started doing this work more seriously and setting up a clinic and a practice, it was really important that it was trans-led. So we set up a trans advisory group, and we open that up for expressions of interest every year, so that anyone wanting to get involved and understanding how VAC works and help inform our services or programs across the entire organisation, anyone can get involved in that. And that's a really useful mechanism to make sure that we're testing our services with the community and people who are affected by our services, so it's co-designed with them, so they actually have a say in what they need, and they also keep us in check. You know, and it's important in terms of transparency that we're working to the betterment and the positive outcomes for trans people, and they feel empowered to be part of that process.
That is fantastic. That's super exciting to hear.
Yeah.
Are there other things about Equinox that people should know about how they can access these services, or how they might get their GP to find out about this model?
Yeah, so everything will be uploaded to our website, which is equinox.org.au, or you can go to the VAC website, vac.org.au. New patients need to call us up, but the details are on the website. But existing patients, it's really simple. You can just book your appointment online. And if someone is not able to go to Equinox and say lives in regional or rural Victoria or somewhere interstate, just talk to your GP and refer to Equinox and print the model out and give it to them, and create a partnership with your GP. Inform yourself about what your rights are. You can go to online spaces like the Shed, for example, and people do a lot of that peer support and peer education. But once you're sort of armed with all that information, every patient should feel the ability to speak about what they need and have their GP respect that. And if they're not getting that, then there should be a complaints process.
Absolutely. So, yeah. Awesome. That's really exciting. It's so good to hear. Yeah. It's such a great thing to have, to be able to distribute to other people.
Yeah.
And you mentioned that it's also going overseas. Can you tell us more about what you mean?
So there's other countries that are sort of looking at what we're doing, and looking at the great model of care, looking at what we're being able to establish, like in New Zealand, for example, and now they've also been awarded a Churchill Fellowship, which means that I get supported by the Winston Churchill Memorial Trust to travel overseas. They award about 100 of those per year, and I'm the first trans person to ever receive one. That means I get to take the work that we are doing and continue to test it and model it against other services and programs overseas. And it means I can go overseas. I'm going to Bangkok, London, Berlin. This is going to get long.
Yeah,
Toronto, New York, Boston, San Francisco, possibly to the UN in Geneva as well, to have meetings of all sorts of international activists and medical centres and human rights activists, to learn about what is happening overseas, what are the gaps, what can we learn from, and bring that information back to share it with the community. And VAC are really committed to always improving, and we're hoping to host a Trans Health Conference next year in partnership with a lot of other community groups and organisations and services.
Fantastic.
So it's an exciting time for trans health.
Yeah, and so you said this is the first time that somebody's been awarded this, a trans person has been awarded this fellowship?
Yeah, to my knowledge, I'm the first openly transgender person to have received a Churchill Fellowship, which is, I think, a huge thing for trans people, that we're now being, our needs and us as people, us as professionals, our healthcare is becoming a priority, and we are being included in some of these really important and sometimes elitist and prestigious events and groups, but that will help us go out and build relationships, increase our level of knowledge so that we can advocate and improve policy to improve our health and well-being.
Absolutely. Congratulations, it's really exciting.
Thank you.
I think that might be all we've got time for today. You've been here with Transmission on Bent TV, and have a good day.